Black Doctors podcast highlights the stories of minority professionals with the goal of inspiring others. If you like what you hear, please subscribe and share with others, because the next generation can't be what they don't see. Tune in every Monday to hear our stories told by us.
Hello and welcome back to the Black Doctors podcast. Today I'm speaking with Dr. Lydia Peters. She is a physical therapist and she practices both in California as well as Maryland as a traveling physical therapist. Dr. Peters, thank you so much for joining us on the show.
Thank you for having me. I'm excited.
Yes, I'm excited as well. So I actually in undergrad switched my majors. I started as a music major and then I changed to pre-physical therapy and looked into PT school and then ended up going into medical school. So it's exciting to speak with you and see what life could have been like.
Okay, yeah. Sounds good.
So Dr. Peters, what's a typical day like for you?
So treating patients, that's the overall thing, but it depends on what setting you go into. So like you mentioned, I'm a travel physical therapist, and with doing that, I've worked in an outpatient clinic, I've worked in the hospital, I've done some work with like long-term care facilities. So usually if I'm in the hospital, we'll go in, check patients' charts, making sure, they're stable, check with the nurses. Are they clear to be seen? Make sure no significant overnight events have occurred. Then we'll go in to see the patient. If it's an evaluation, that's our first time with the patient. So checking their cognition, their vitals, seeing what their function is, because once again, like in the hospital, trying to see, do they need to go home? Do they need to go to a skilled nursing, like subacute rehab? Or do they need like further evaluation and things like that? So that's usually what it will look like in the hospital. And then as far as in the outpatient clinic, they already, have our schedule up. And then if it's once again an evaluation, that's our first time seeing that person. We see a wide variety of patients and ages. So low back pain, knee issues, post-op surgeries. So they're coming in, we're assessing, seeing what they're at, establishing a treatment plan, treating them, trying to give them some treatment that day as well, and giving them something to take home so that they can start working on, what we've seen in the clinic.
Nice. So there's hospital and outpatient settings. And then how do you work with sports teams or athletes, and how do you differ from the athletic trainers?
So I personally have not worked, I've worked with like high school athletes and things like that, but not like I'm not in sports medicine, physical therapy, I guess, or haven't like worked with any teams. But that's a great question as far as, the difference between like athletic trainers and things like that. There's definitely a lot of overlay as far as knowledge of, the human body and things like that. But I would say the thing that sets physical therapists apart is that just that background medical knowledge that we have. So it's not only just like, I'm giving you these exercises and progression, but it's taken into a whole account of your past medical history, what your goals are, if you have any like comorbidities or anything like that, so that we're constantly checking in, making sure that this is, especially if you've had any injuries or anything like that, just making sure that you're safe. And other professions do that as well. But yeah, that's what I would say is kind of like that little bit of a difference there.
Yeah. And what's your favorite patient population to work with?
I would probably just somewhere in the middle age to older. I work with a lot of geriatric patients. That's who you're seeing in the hospital or even in the clinic, but they're fun. They're a fun group.
Yeah, I know during residency, because I did a little bit of work in the pain clinic, so we would oftentimes refer people out to physical therapy kind of as part of their management for back pain. So it's good to see the other side of what goes on.
Mm-hmm.
So for you, what made you choose to go into physical therapy? How old were you when you made that decision?
I think I was about 24, maybe, when I decided. So a little later, it's not something that I was like a child and, I want to be a physical therapist, or I played sports and saw what was going on. But I didn't know what I wanted to do for a long time. I graduated high school. I started college and I was doing nursing. I was like, I like healthcare. Let me do this. So I took a semester. I was doing like the gen eds for nursing. I was like, I don't like this. I don't want to do this. So I decided to do massage therapy. And so I went to a school and did massage therapy. That was like a 1.5-year program. And I worked for about 3.5 years as a massage therapist. And during that time, it was great. I enjoyed it. I really liked it. But it was also, it fluctuated so much. I lived in like a small town. So some people would cancel and that would affect like, my pocket. I'm like, can't have this. So I started thinking, what else can I do that's kind of like in healthcare, still working with the human body and is helping people. So I was talking with my best friend and she was like, I'm thinking about doing physical therapy. And I looked into it and I was like, this kind of aligns with what I want, I think. So I'm going to give it a shot. And she was going to go to a grad school in Michigan because there was a boy there. And ended up, she didn't go there. She didn't do physical therapy, but I just kind of like ran and took off with that and ended up going to school in Michigan.
Okay. So you already finished college and this was physical therapy school?
Yes. So I had, I did massage therapy. That was like I did an associate's, did massage therapy. And then I worked for about 3 years as a massage therapist. That's when I had the conversation with my friend. And I was like, I think I want to do PT, but I didn't have my bachelor's. So then I went back, got my prereqs for PT school, finished my bachelor's, and then I applied to grad school.
And what are some of the prerequisites for PT school?
So the sciences, chemistry, biology, physics, psychology, abnormal psych. Those are the biggest ones, just like basically having the sciences, the primary ones.
Yeah. And then how was the applications process to physical therapy school?
I might have tried to block that out, but I don't think it was
relive those traumas.
Right. They have like the PT cast, so you go online and you input, your transcripts and your references and the hours that you worked and everything. It was pretty smooth, though. I think some schools you did have to pay the submission fee or something like that. So I applied to, I believe, 4 schools, and then I got accepted into one. Honestly, though, I didn't even really fulfill like all the requirements for some of the places that I applied, so that's on me. But I believe I ended up where I was supposed to be, so it worked out.
Awesome. So when you showed up to physical therapy school, was it everything you hoped it would be? What was that like?
So I knew it was going to be rigorous. I knew it was a competitive program to get into and to stay in. Like they're not, you're not getting bad grades because if you got more than like 2 C's or anything less than a 77 was an F basically. And if you got more than 2 of those, then you're like out of the program. So that was just my mindset, like just do well, like do not mess up. And it was challenging. It was most likely one of the most like challenging things I've done in my life. Just class from 8 to 5:30 basically. You go home, you eat, and then you study till you go to sleep, and then you do it again. So it was a lot. It was what I expected, though, so I'm glad I had that mindset going into it.
Yeah, and how long is the program?
The program is 3 years, so it's 2 years of didactic work. You're on campus, labs, lectures, all of that, and then the last year is clinicals. And so the school that I went to, Andrews University in Michigan, they require you to have an orthopedic rotation, a neuro rotation, and an inpatient rehab rotation. So those lasted anywhere from 2 to 3 months. So for each of those. And then the last rotation was an elective. You could pick whatever setting you wanted to.
Gotcha. And how did you pay for PT school? All student loans?
Yes. Yeah. Yes, that's a sensitive and sore subject for me.
I'm in there,
but
right there with you.
Yeah. And if I could tell someone who wanted to do PT school, I would advise them, like, get your general classes out of the way at a community college. I went to a 4-year university, was taking like general psychology. There was really no purpose in me doing that at all. But I didn't know, at the time. So I would recommend someone to go to a community college, get your generals out of the way. And then if you have the ability to go to a state school, just try to decrease your costs overall. Mm-hmm. so that it's not hanging over your head once you're actually, finished with school.
That's good. You got to keep the coins in your pockets.
Yes.
Yeah, a lot of people, I think we're starting to spread that information now that maybe a 4-year school wasn't the most efficient use of resources.
Right.
And then coming out of physical therapy school, there's a board exam or certification. How's that process?
Yes. So after you're done your clinicals, we go back on campus. There's a time on there where we also present our research. So we have a capstone project that we've been working on for like the last 2 years. We present our research, and then we have graduation. So there is the national test or the boards. So as a student, you have the option to take them before you graduate or after you graduate, because I think they hold them for about 4 times throughout the year. I opted to graduate, just kind of get all that stuff behind me. And then I took about 2 months to study for the boards, which is a 4 to 5 hour test. Once you pass the boards, then you're nationally certified, but then whatever state you decide to work in, you have to just go through the licensing procedure for that state.
Okay. No, that's so cool. Thanks for detailing that process. Full disclosure, I'm in the Navy. One of my corpsmen, which is like a medic, HM3 Rose. Shout out to HM3. I think he's HM3 or maybe HM2. That's a Navy rank. Sorry, HM2 or 3. But he is looking at getting out of the Navy and going into physical therapy. But he was kind of hung up on becoming an assistant physical therapist first and then doing PT school. And what would you say to this guy about becoming an assistant physical therapist versus becoming a physical therapist?
Well, first I have a question. Would he be doing PTA to work and then do PT, or is...
Yes, that's his plan.
What's okay. I don't think that's a bad idea. You're able to, well, actually, so when I was in PT school, I didn't work, and no one in my class did either. And usually it's not advised that you do just because there's really not time for it. So if your plan is to do PTA school so that you can work while you're in PT school, you might not even have the time to work. So I'm not sure if that would be the best use of time, because PTA school, I believe, is 2 years. And so you're basically doing 2 years and then going to PT school for 3 years and not even using the PTA degree as much. So you might just want to do a straight shot.
Gotcha. And what else would you say to students that are listening and considering going into physical therapy? Don't
let your own limitations stop you from pursuing physical therapy or continuing in it once you're in the program. I know for me, one of my I guess roadblocks or setbacks was just the mentality I don't know if I should be here, and am I going to pass this test, and am I going to stay in this program? But one of the things that I was constantly reminded of was that I'm smart enough and I'm good enough and I can do this. So that's what I would tell someone, if this is your goal and it's your passion and that's what you want to do, then go for it and just apply yourself to it. Don't give up and just keep going. Because I know after my first year, I wanted to quit. I was I'm tired of this. I was just laying in bed. I'm like, I don't want to go to school. I don't want to do this anymore. Zero motivation. And I was just not in a good place. And the only thing that kept me going was I'm like, well, I can't go back home and tell people that I left. It was an ego thing, that's embarrassing. So I kept going. But yeah, once I got over that and just kind of pushed through, the rewards were definitely there. One of the things that PT school helped me with was it gave me the confidence that I can do anything, literally. If I did that, I know that I can, if I want to start a business, I can do that. If I want to do a triathlon, I can do that, which I've done. I've done 2 of those. If I want to quit my job and move cross country and work out in California, I can do that, which I've done. So it just has really, it's given me the sense that, if there's something to be done, I can do it. So that was really, even if I don't practice PT, forever or in the future, that's something that I've learned that I can keep with me and apply to all aspects of my life.
Beautiful. And how was your support system in school especially with your other classmates?
It was good. So the physical therapy program, they told us beforehand, they're like, you guys are going to be a family. And like, I met my classmates the first day and I was like, I don't like y'all. Like, no, thanks. I'm just kidding. I'm 21, class of 2016. But no, that was my mentality. I was like, I don't really see that happening. Just because it was, I just didn't know these people. But when you're with people all day, every day for like 2 years straight, you definitely do, you develop a bond, and everyone wanted to see everyone else succeed. So, if there were study groups or one-on-one sessions, and the professors were good about that as well, just making sure that you're okay and you keeping your head above water. As far as like my own family and friend support, I know they supported me, but I also didn't really have time to like talk to them. And my mom told me later, she's like, Lydia, I didn't want to call you often because I knew you were studying. I was like, oh, Mom, sorry, you could have called. But at the same time, I didn't even really notice because I was just like working, studying and stuff.
Yeah, bees like that sometimes.
Yeah.
But now you can catch up on all that time that was lost.
Exactly. Yeah. And there were, weddings and births and graduations and things that I missed. But once I graduated, I was like, where's the party at? Where are we going? Let's go. I'll be there.
How over the last year, right, 2020 kind of threw a wrench in everybody's plans, but how did that affect your practice or your career?
Yeah. So I was finishing up a travel assignment in Maryland. The University of Maryland, Baltimore, Washington Medical Center, and I was covering a maternity leave, and it was ending, and I was like, okay, I'll just get, another contract like I always do. And this was in March of last year, how March went. I was looking for, my next travel assignment afterwards, and census was low everywhere. Places were not hiring. I was like, okay, maybe I'll take a perm position, still not hiring. So my mom lives in West Virginia. So I was like, let me go out to West Virginia. I'm just going to chill out there for a while. And so things had been very slow for most of last year, as far as travel PT wise. And they started to pick back up probably in the fall, just having more jobs that were opening up and things like that. So it was definitely different because, when you go into healthcare, everyone says, if you get a healthcare job, you're going to have a job forever. Right. You'll never not have a job. So it was very eye-opening to know that that's not always going to be the case. So that was eye-opening, but I was blessed to have the support of my family, and it did allow for me to look into other interests, other things that I want to do besides physical therapy as well.
Yeah, and one of those interests, so as a physical therapist, you work very closely with the human body, and you were inspired to develop a product that your patients and your coworkers could use on their bodies. So tell us about this product that you're developing.
Yeah, so while I was at home, I had time to, think, and I was like, something that I see, especially now, since not only our healthcare professionals, we've always been washing our hands, just part of hygiene and not, having cross-contamination and things like that. But the general public now is also getting on board with washing their hands regularly. And I know that I've always struggled with dry hands because I'm washing my hands after every patient. I'm washing my hands even while I'm with the patient. If I touch one thing and I'm touching something else.
Don't lie. Y'all be rubbing on them feet, man.
And then we wash our hands. Or we'll put some gloves on, whatever. So I would wash my hands, and so my hands are just dry. And sometimes I would be doing a manual muscle test on a patient, and I look down at my hands, and I'm like, oh my gosh, this is embarrassing. I'm like, you know what? Doesn't even matter because I'm helping this person. So what if I have dry hands? But I say all that to say, I've noticed that for myself, I've had dry hands, coworkers, colleagues, they mentioned the same thing. And so I wanted to develop something that could target that and also make it so that's easily applicable and not greasy because, we have to type on our computers and things like that. So yeah, that's what I have been working on, and also just deciding, am I going to do this myself, or if I'm going to outsource this, just making sure though that it aligns with the goals for the company that I have, which are being natural, using things from nature just to promote hydration, moisture, and
I love it.
Yeah.
And what's the name of your product?
It's called Natural Verity. So verity means truth, and the premise is that the things that we need for our bodies we can get from nature. So it's nature's truth, just providing us with the healing properties that it has.
You sure Ash Begon's not a better name?
I really like that, but it's not resonating with me, in my target audience. So yeah, no.
All right, maybe next time. Or the next product. The next product you make, whatever you make for the feet, we'll put it there. Or make something for the knees.
Exactly, that's what I was going to say, for the feet.
Awesome. Dr. Peters, thank you so much for joining us. Thank you for the excellent information you provided on the field of physical therapy. I know HM3 Rose is going to appreciate this because I'm going to make sure he listens to this episode. And a lot of other students are out there learning as well. Looking forward to seeing your product come to market. Sign us up for a bottle or jar or tube or however you're selling it.
Yeah. Thank you so much for having me. This is the first podcast that I've been on, so I feel like I'm on a talk show host. I feel honored, so I appreciate it. Thank you.
That's what's up.
The Black Doctors Podcast is a nonprofit, volunteer passion project with the goal of inspiring all who listen. Tune in next week for another episode of the Black Doctors Podcast with Dr. Stephen Bradley, your friendly neighborhood anesthesiologist.